Hey YouTube family, welcome to Dr. G Pediatrics, and today I'm going to do a question that I get a lot from parents, and I just wanted to kind of talk through it so you guys can understand what I think about when I hear this question. So the question I've received was, Dr. G, my 5-year-old son is complaining that it hurts when he pees. Does he have a urinary tract infection or UTI? Great question. Most likely, no. For boys, it is extremely uncommon for them to have a urinary tract infection. And when we normally use that term, we're talking about the infection being in the bladder. So yes, if this was a 5-year-old female complaining of burning with urination or burning to pee, definitely would be up there of my thoughts of a possibility for him. Not to say that a little boy cannot get a urinary tract infection, but is extremely rare based off of their anatomy. So the way a bacteria germ can basically enter through the pee opening, is the fancy term for it is urethra, and travel into the bladder and then create infection is less likely, just given the way the anatomy of what a boy part looks like and what a girl's part looks like. So is it something though that should be looked into? Absolutely, because there are different reasons for a little boy to have burning when they pee. Usually it's due to there being a little scratch or irritation right at the tip of the penis, which is again the urethra. And if they've had some type of irritation or the pants have rubbed in the wrong way and it's created a little bit of a cut, then when the urine comes through and comes out, it's going to burn, right? And so most of the times that's the reason for it. However, if your little one is complaining of that, then the best way to get that teased out is by having them seen in person and peeing in a cup. The fancy term for that is getting a urinalysis. That way, the different things can be checked in the urine. So one of the main things for a urinary tract infection or UTI would be checking for WBCs or white blood cells, which is the cells in the body that fight infection. Should not be there. And then the other thing is something that's a little bit more specific that we can see is something called nitrates, which is usually something that we'll see in a urinary tract infection sample, not all the time, but most of the time. And that can help tease out whether this can be an infection or something else. But the awesome thing about a urinalysis or peeing in the cup is that it can also check for other things that we really shouldn't see in the urine, so that if we see it in a child, then that's going to prompt us to have further investigation. So I would definitely, if your son complains about burning when they pee, the first thing I recommend is applying a little bit of diaper rash ointment, like a zinc oxide based ointment, or a little bit of Vaseline to the tip, so that if there is a cut, that's gonna just create a little bit of a barrier, and see how he does with that. If it gets better and he doesn't complain about it anymore, then that's probably what it is. If it's something that's persistent, even with you doing that, then yes, definitely have them evaluated with a urinalysis to get a further evaluation. So I hope you found this helpful. If you did, please let me know. Till next time, have an awesome day.